Hi, I'm Dr. Neil Barshis. I am a vascular surgeon at Baylor College of Medicine in Houston, Texas. I am going to give you a third set of tips, a third video that's going to talk about problems or just things that are, I want to say errors, but things that you should try to avoid in giving a patient presentation. The first is hands down the most common. Essentially, what some people have called reporter mode, um, what I sometimes call a data smorgasbord. There's various forms of basically presenting a lot of data, laying it out, and then um, just forcing the other person to figure out what's relevant, to assemble the different data points and put together something that is organized and congruent. This is something to be avoided, even in the situations where, like I mentioned in the earlier video, you don't know what the problem is. You should at least have some educated guesses. You have it whittled down to maybe 2 or 3 things in a differential diagnosis. You have something that you are weighing a little bit heavier than the others because of the information you've gathered and weighed, but you're not sure what it is. Even there, you're not just, expelling a whole lot of data and then forcing the other person to make sense of it. You're processing it, and that's important to do. I mentioned earlier too that as a trainee, this is the period of time where you're going to get feedback, you're going to have oversight. You won't always have that, so take advantage of it now. So even when you don't know, even if you're not 100% confident what the diagnosis is, I would say propose a plan, and propose it. Don't be misleading in how confident you are with a diagnosis or with a management plan. Be forthcoming with that. But even still, put your chips down somewhere, commit to something, and then get feedback on that diagnosis you're proposing or the management plan. I think that's the best thing to do. I mentioned different forms of this, different iterations of this. I would summarize it to say any time where you're deferring decision making I would say, view it as a lost opportunity to practice your own decision making. And this goes for not only the big thing, not only the making a diagnosis or making a plan for the primary problem, but I'm also talking about all the little details. It's a game of inches, surgery is. So all these little details matter. Okay, great. You've made the diagnosis of, symptomatic carotid stenosis. What are we going to do to manage, this medication, the metformin? How's the patient going to get a CAT scan and the patient's been on metformin? What are we going to do about that? And we're going to admit the patient. When are we going to do the operation? Like really practical problems, really specific problems, very specific questions. Try as much as you can to answer those questions, provide some at least provisional answers to those problems, to those questions, because this is important practice, good practice for you to do that. One iteration, one version of deferring a decision that I'll make mention of is when someone says, like, here's the problem. I don't know in this situation if you prefer doing this or prefer doing that, as though there was a lot of heterogeneity, like heterogeneity, surgeon or physician heterogeneity in decision making or management, like that's so influential that you can't make a decision without knowing someone's preferences. And that's really it's rare that I'll say this, it's rare that you can't propose a plausible plan, a good plan, a quote unquote board's answer plan, even if you don't know what someone's preferences are. Again, you put your chips down on the table, you say what you think is a good management strategy, or the best management strategy, I should say, defend it. And then if someone has a preference for a particular approach, or, medical management, whatever, then, that's where you'll discuss that, and you'll discuss the rationale for that. But don't let that be an impediment to you proposing a plan. And then one final thing, like I said, that is hands down the most common limitation or error people make when they're presenting patients. The second that I'll mention is just in general short-term decision making. Ordering a test, that's not a management plan. That's just one step in a decision tree. If you've recognized the problem and you say, okay, my plan is I'm going to get a CAT scan, there's a whole lot more beyond that. Even if you're proposing that as the next step in the patient's management, you should not only be prepared to, but you should just put up front, I'm looking for this. This is my binary decision tree, or at least, these are some if-then statements that describe, that tell you, I know what I'm looking for. I'm seeking these specific things. It's not just a fishing expedition. And then if I find these things, I'm going to do this. I'm going to recommend that. That makes you come across as you're not just, you're going to get a CAT scan for everything, every problem that comes up. You actually know what you're looking for. And the diagnostic test, the imaging test, the lab results, these are just tools to help you get information to fine tune your decision making or to confirm a diagnosis. So to summarize everything, having a very good first sentence, one that is very clear, one that doesn't save any surprises for later on in the presentation. Having a presentation that is concise, it's organized in the way that you're probably taught in medical school to present patients, and avoiding some of these common errors, some of these common pitfalls, taking opportunity to make decisions, propose plans, avoiding just single steps, short-sighted management plans, thinking through the entirety of the patient's hospital stay, and then maybe even beyond that, maybe even outpatient management, maybe even long-term follow-up. Those are important things to do. I think if you practice doing all these things, you incorporate them into, on a daily basis, talking about patients, presenting patients, I think it's going to help you present like a pro and really be able to discuss and converse in an intelligent way. Good luck to you. Hope you have found these helpful.